Hello, my name is Dr. Bola Sogade, and I'm a women's health specialist. I created Cocoa Pods podcast for women and everyone involved in the betterment of the health of a woman throughout her life cycle, for education beyond the doctor's office examination room and beyond the operating room. During the COVID-19 pandemic, there was a lot of despondency and fear, and I hoped that talking about women's health care, engaging women in betterment of their health, identifying health issues, and learning about how the problems can be mitigated would ultimately educate and empower women as we bring to light some of the burning questions in this ever-yearning hope for a longer, healthier life as we all live our everyday lives. The hope is to also involve stakeholders in women's health care in the discussion as we strive to move the needle in a positive direction for policy changes. Indeed, I have the God-given knowledge, experience, and expertise to address these issues. I studied in my home country of Nigeria, and I have worked in my home continent of Africa. I obtained additional specialized training in the United States. I have seen the sufferings of women on a global scale from my visits to every inhabited continent of the world. I indeed have something to say. I continue to seek solutions to problems, especially in the state of Georgia, that is currently ranking number 49 of 50 in maternal morbidity and mortality, that is, women becoming very sick or dying from pregnancy and pregnancy-related complications. I am the Community Advisory Board Chairwoman of the National Institute of Health-funded Georgia Improve Project, an acronym for implementing a maternal health and pregnancy outcomes vision for everyone across the state of Georgia. Georgia Improve Project aims to establish a community-focused multidisciplinary perinatal care network to inform priorities for preventable maternal mortality and decrease severe maternal morbidity and promote health equity. I also believe women's health should involve the least intervention when possible, and I founded the first physician-led, freestanding and state-licensed birthing center in the history of the state of Georgia for low-risk pregnancy care and delivery. I have applied the advances in technology to address women's healthcare issues. I believe in harnessing natural processes, but when surgical intervention is deemed necessary, to do things in a minimally invasive manner. And I became the lead minimally invasive robotic gynecologic surgeon in my area. I have been on the inside with respect to healthcare systems and see where the benefits lie, but most importantly, where the problems remain unaddressed. I also see the barriers to having these problems addressed. In season 1 of Cocoa Pods podcast, we talked about issues ranging from a well woman visit, especially from an obstetric point of view, and how it provides an excellent opportunity to counsel women healthcare seekers or patients about maintaining a healthy lifestyle and minimizing health risks. Indeed, there is a shifting and complex landscape of women's healthcare involving many women, especially minority women, low-resource women, women in rural America, and now even affluent and seemingly educated women. Women seem to not know nor be empowered with healthcare education that could save their lives or simply put them in a better health situation. Also, women may not receive all the recommended preventive services for one reason or the other. In season 1, we talked about how the women's healthcare provider has the opportunity to contribute to the overall health and well-being of women throughout the lifespan by providing recommended preventive services and counseling. Just talking, in taking a comprehensive health history, specifically obtaining detailed information on symptoms or on just what's going on, by an empathetic doctor and a past medical history and gynecologic history will inform if certain components of the physical exam, including breast or pelvic examination, are indicated at that visit, and will inform shared decision-making for these examinations. We also discussed how the family history should be used as a risk assessment tool and should be completed and updated regularly to ensure the most comprehensive assessment of a woman's personal risk factors. Of key importance, we discussed health items for a reproductive aged woman, the development and discussion of her reproductive life plan to ensure that medical testing and treatments provided are aligned with her current and future plans. I, as a board-certified obstetrician gynecologist and a family physician, provide care for women across the lifespan, and periodic well-woman visits and conversations are appropriate and necessary also for perimenopausal and postmenopausal women. In this past year, we have had guests ranging from Dr. Nanette Wenger, who has done the most research in the United States on women's cardiac health issues, to Dr. Brad Boots-Taylor, maternal fetal specialist with training at the University of California in San Francisco, in the episode, Why Did My Favorite Black Doctor Suddenly Disappear?, where he was discussing reasons why some professionals are preventing from practicing their profession and not for a lack of skill or compassion. We have had mothers like Mrs. Shamikia Brown simply talking about issues of pregnancy, motherhood, and career. And we have had medical students and college students like Erin Owens and Kirsten Wilder giving their take. In season 2 of Cocoa Pods podcast, we want to continue the storytelling. We want to talk about issues ranging from, for example, how women have sacrificed their bodies, endured pain and suffering, willingly or unwillingly for science, for our better health, to all what it means to have a cesarean section. We want to talk about how to improve your mental health and live your best life healthily. During season 2, we will indeed shake things up a bit and transform our conversations by encouraging our wide array of podcast guests, which includes some new and familiar voices, health professionals, and life experiencers, period. Ask one question of me, the host, so that I can expound on methods and strategies that women of all walks of life can incorporate into their lifestyle for the purpose of reducing their own risk of, for example, maternal mortality and morbidity. I will also talk on issues women are requesting of me to elaborate on. This will give listeners, particularly women, the inside scoop as we cultivate greater and healthier dialogue between specialists and women's health professionals and the lay public, while building up the safe space to address the greatest problems and risks that women are predisposed to and subject to based on biochemistry, habitual behavior, family history and relationships, education level, socioeconomic status, districting, and systemic inequalities. This season will be jam-packed with enticing information ready to impact the lives of women and those who care about women. We do hope you tune in each and every Thursday to listen to Cocoa Pods, and also check us out on our new website, cocopodspodcast.com. If you know of a story of bravery and resolve involving what a woman did to save her life in healthcare, or what female healthcare providers endured in their careers, for example, as doctors, like financial losses, or when their career was cut short due to discrimination or retaliation, we want to tell those stories. Email us at bcfndfoundation@gmail.com or send a tweet to @bcfndfoundation. I want to use this opportunity to thank all of you, our listeners, for tuning in and subscribing to this podcast. We want to thank our behind-the-scenes support staff, Adriana, Elijah, and Olu. Thank you very much.